good afternoon. I want to welcome you to our Well-Being with the Dean conversation. And our guest today is Jocceline Hernandez. She graduated from CSUN with a BS in Family and Consumer Sciences with a specialization in Nutrition and Dietetics and Food Science. She also spent time in our dietetic internship program. And during her clinical rotation and the medical center with the WIC program, she was able to teach breastfeeding classes and integrates breastfeeding education into her nutrition counseling sessions. She's a graduate of the 2011 class. And welcome and thank you for being here. I'm just so excited because I want to finish talking about you, but I just wanted to say those things because I think it's fascinating. She also is a registered dietitian. And for those of you who don't know, an RD is a very prestigious credential and a very difficult credential to get. She's nodding. Yes, you know, it is. It really is. And she got her master's in science and nutrition here at CSUN in 2014. And she is a nutrition consultant with the Los Angeles County Department of Public Health, Division of Maternal, Child, and Adolescent Health. Previous to this, she worked with the Northeast Valley Health Corporation, a community health center, where she works directly with expecting mothers, providing essential breastfeeding education and resources to allow them to have successful breastfeeding experiences, which I'm going to ask you about because I know how important that is. And so these conversations that we have here are just a way to get to know alumni and showcase the impact that HHD has had on their lives and what they're doing now, and a chance to talk about the well-being and what it means to them. They also serve to inspire and motivate students and assure our community partners how to engage our alumni. So let me just start by asking you a general question that we ask everybody, and that is, the College of Health and Human Development is known as a college of life, okay? And as an alumni working in nutrition, lactation, and breastfeeding education, what does well-being mean to you?
Thank you, Dr. Webb. So well-being to me means being able to check in with yourself and making sure that you are okay yourself and making accomplishments on a day-to-day basis, whether big or small, before extending out and reaching out for the well-being of others.
Well, that's absolutely fascinating because one of the things that happens is you're talking about the whole of the person, not just the way they're thinking. You're talking about the way they're feeling, the way they express those feelings in terms of just nutrition, as well as just their mental health piece, which is an important part of well-being. I like hearing that kind of definition because it really fits in with what I know about nutrition and what I know about nutritional scientists and how you guys think about people. So this is actually fascinating to me. So tell me this, how did you transition from CSUN to your current career position?
The fact that CSUN allowed me to have so many different community engagement opportunities, I was able to easily transition into many of the positions that I have had. And one prime example, for instance, is when I completed my WIC dietetic internship, I was then hired by the WIC program and I worked there for some time. And, you know, I got to know a lot of staff and a lot of the community as well. And from there, I then transitioned into their outpatient clinics. So everything that I have encountered throughout my academic journey, I feel like paved the way to now my profession and having different positions that I've had throughout the years. So definitely CSUN, with the different opportunities that were provided to me, just really put me out there and allowed me to meet a lot of different professionals and definitely a lot of community members that till this day I'm still partnering up and collaborating with.
Can you talk a little bit more about the WIC program? I mean, tell people what WIC means and then and how you use this in the work that you do, because it really is deeply connected to nutrition and nutritional sciences.
Yeah, so the WIC program, so WIC stands for Women, Infants, and Children, and it's a supplemental nutrition program that provides nutrition education, breastfeeding support, and then also food, the access to healthy foods through what's called now the WIC card. And through that, eligible participants are usually Medi-Cal eligible participants who are pregnant or have children up to the age of 5 years old. So they get access to, again, education and then access to healthy foods as well.
I'm recalling some of my earlier days. They used to get WIC vouchers, and it would have to go to the store, and there would be certain items that would be marked as WIC approved and not WIC approved. Do we still sort of have that, or is it more subtle?
Yeah, the full of different WIC foods still exist. It's now just they've eliminated the checks or the vouchers,
Mhm.
and they've now moved to cards, which they're kind of like the CalFresh cards
Mhm.
that gives us access to healthy foods, but these are specifically for children and then for pregnant mothers as well. And I think it has been a great transition into having access
Mhm.
to these foods through this card, because especially right now with the pandemic,
Mhm.
we're trying to minimize too much interaction, in-person interaction. So they're able
Mhm.
to, receive these benefits through a card.
For a long time, there was a stigma attached to WIC. And, I mean, you work with people, you clearly understand people need these things. So what can we do to help people mitigate some of the stigma attached to it and help improve our conversations around WIC?
Yeah, so that's actually a really good question. So I think, even through my academic journey, I didn't know about the program myself,
Mhm.
and learning about it, and especially with how nutrition is like kind of like the center point of this program, it just became an integral part of my profession. And I think what many may not know is that it really gives access to the most vulnerable populations, those mothers that need to have access to healthy foods to avoid things like anemia and other complications that may affect the growth of the baby, which then obviously then offsets to with the birth outcomes as well. So currently in my position, even though I'm not directly working with WIC anymore, I still get to collaborate with them and be able to share what they offer now in a county level and make sure that other prenatal
Perfect.
clinics, have access to those resources and now
Mhm.
also share it with their patients as well.
So since we're talking about this, and we're talking about nutrition and and maintaining health of babies and things, it leads me to my issue with lactation. How did you get started, and how is that working out in terms of, because I think that's probably mother's milk is very nutritious, but if you don't have the right diet, your milk's not so good anyway.
Right, exactly. So my journey to becoming a lactation educator started here at CSUN. I
Mhm.
was very passionate about nutrition, and here I was very engaged in community nutrition. I always had a love for that. And through opportunities with my professors, there was a lactation program that was recently started. And I was actually one of the first cohorts that finished that lactation internship, where I was basically exposed to the first phase of the stages of the life cycle, which is, through lactation, the baby's first
Mhm.
nutrition. So it was really fascinating for me to learn about that. And then also not only learn about it in a classroom setting, but actually also have the opportunity as a community engagement project and work at a postpartum unit through as a student, and be able to see postpartum mothers and educate them on what I had learned in the classroom.
Mhm. Mhm.
So now in my current position, I get to now train the trainer in
Oh,
having
good.
them be able to disseminate that breastfeeding education to their patients, even though they may not be lactation professionals or experts. They can at least provide some type of education to help that client, feel more empowered, and then also know about the resources out there in the community.
This is really amazing. So now I'm going to ask you a question. What kind of advice would you give to our students today, particularly students like yourself who are very interested in mothers and early nutrition and as you said, the beginning of life. So you really encompass our whole idea of a college of life. It's so wonderful. Um, to give them advice as to how to get started in areas like lactation counseling, particularly for some of our male nutrition students.
Yeah, so I would highly advise to be able to recognize opportunities as they come, big or small. You want to be able to try it out and see, what you are able to take from it, and definitely participate in a lot of nutrition supplemental programs that are out there and volunteer opportunities. And, right now with a lot of opportunities being now virtual, there's many pathways that you can take and take advantage of. So definitely don't be afraid of starting somewhere, because I myself had no knowledge of lactation. And now 6 or 7 years later, here I am still, spreading and preaching this, wonderful type of nutrition education. So definitely be able to recognize those opportunities.
Thank you. That's really good advice, because I think sometimes people are afraid because they're afraid what might happen. And so to talk about that in that sense is really exciting to me to hear you say that, because that's what education is all about. You're supposed to challenge yourself. I mean, something difficult. Okay, that's great. You want to have a difficult challenge because it makes a difference. So if a student was coming along and they said, listen, I don't understand nutrition. Why do we need to do this? What would be your answer to them?
Well, I think that they need to, again, kind of reach within themselves. How would it be important to you, so that therefore you can now, translate that information to help others, So what makes nutrition important to you? How would it benefit you in your health? And I think that will help you kind of blossom into how you can help others as well.
So let's talk for just a minute about the relationship between diet and disease, because in the communities of color, we have lots of diseases that are related to diet, that if we address diet, we could probably have some reduction in some of these diseases like diabetes and things like that. So what advice would you give people to begin with? I don't want to put you on the spot because that's a pretty tough question, but you know what I mean.
Yeah. So I would say that, food is medicine, and small little feats really make a difference, and as I said at the beginning, kind of check in with yourself on a day-to-day basis and start small and then build upon those healthy habits, whether it be that, you focus on not having sugary drinks, on certain days of the week, or possibly trying out, I always tell clients as well, maybe you've never tried whole grain products, but you can at least try, if you make yourself a sandwich, try it with one slice of bread of your favorite type of bread, and then one slice of whole wheat bread. And that way you at least get an introduction to, maybe a healthier alternative that you have not tried before. And at least you still get a taste of, what you are used to. So, health comes in just so many different ways. And I think that as long as you recognize that there is a need to possibly make some modifications to your food and also your lifestyle, the rest will kind of just fall into place.
I must say, I really admire the way that you talk to people about how they can make important changes in their lives, because it's non-judgmental, it's very clear, and you're giving people choices that make sense to them. I mean, I hadn't thought about that. Well, wait, you like white bread, but why don't you have half a white and half a wheat? Yeah, pretty much soon you'll acquire the taste. Exactly. But I like that. I mean, a lot of times when people go to professionals, they think they're going to just dump on them, so they avoid them. But the way you're talking is very friendly and very helpful. And I guess this is part of what you learned when you were here at CSUN. I mean,
right.
Yeah, I really like that. I really like that.
Another great thing with being having the opportunity to be at CSUN was that you were exposed to a lot of different cultures and definitely a lot of diverse backgrounds.
Right,
so you
right.
build upon that knowledge and experience to make sure that you're also respecting that person's culture as well, and making it approach things in a like you said, non-judgmental manner, to make sure that you're still respecting their culture, but at the same time also tying it in with their health status as well.
I really like that you said those things. I really do, because it points to what we try to teach people. Apparently we're doing a good job at it. because that message is getting across to the students and to professional people like yourself as you come back and repeat that message to our students and our alumni about what we should be doing. I really thank you so much for talking to me today, because this is just fascinating. I love this. I really, John and those guys know this. I love this part of our job where we get to talk to alumni and successful people. And, and here you're so young, so it's even better because you're early in your career and yet you're very established. You already have things that make sense. You have a pattern. You understand the communities that you're working in. And I don't think we could ask for much better than that. So I really want to say thank you very much. I have just enjoyed my time talking with you today. And I look forward to being able to have many more interactions with you, whether it's here or somewhere else across the universe. So thank you so much for participating in our conversation with alumni today. Thank you.
Thank you, Dean Webb.